Hello, my name is Alexander Mostovoy. I'm a board-certified clinical thermologist with over several decades of clinical experience and also happen to be the president of the Canadian Association of Clinical Thermography. Today, we're going to be talking about fibrocystic breast disease. Years ago, I was convinced that it's not really a disease, it's more of a condition. But as I have learned more about this, I realized that it is actually a disease because it has a process. It has a particular kind of, it has their own causes, symptoms, and finally, it has its own progression. So without further ado, please join me in exploring this further. The breast has always been the symbol of womanhood and fertility. And as a result, disease and surgery of the breast evoke a fear of mutilation and loss of femininity. Understanding how some of you may feel, I also want to dispel your fear, because there's definitely a cause for prevention. There is definitely treatment, and I'm hoping that at the end of this presentation, you will come to the same kind of opinion as I have, that it's definitely treatable, and therefore I urge you to be proactive about this. Now, what are the symptoms? Women that have fibrocystic breasts usually complain about breast pain, slight or severe swelling of the breast, tenderness, thickening, lumps, pain, and tenderness, mostly in the upper outer quadrant. However, the pain may also radiate into the axilla, chest wall, even side of arms, and occasionally there's also burning and itching. Fibrocystic breast disease is common. However, just because it's common, it doesn't make it normal. Here is a structure called fibroadenoma, and here we can see structures that are fluid-filled sacs that are called cysts. They will expand and contract under the hormonal influence. Fibroadenoma, on the other hand, will feel like a very hard, rubbery substance. Now, keep one thing in mind, that benign breast diseases account for approximately 80% of all breast pathology. Over 50% of women will have, at some point in their life, fibrocystic breast. Definitely, it's more common in younger women, women of childbearing age. Usually, it's as a result of hormonal changes. And as I mentioned, there are mostly or primarily two types. That is fibroadenoma and cystic breast, and therefore it's called fibrocystic breast disease. Now, symptoms and signs of fibrocystic breast, it usually is fairly rare in ovulating women, and multiparous women, women with multiple pregnancies, usually do not suffer with fibrocystic breast. However, in 40 to 60% of women with fibrocystic breast, they will suffer with irregular menses, with dysmenorrhea, in other words, painful menstrual cycle, and menometrorrhagia, which is a prolonged and heavy period. They will also have ovarian cysts. They kind of go hand in hand. And then 1/3 of them, they will get nipple secretion as well. Now, there are three phases of fibrocystic breast. Phase 1, moderate stromal fibrosis. Phase 2, progressive fibrosis. And finally, phase 3, pronounced fibrosis. In other words, in phase 1, we're looking at hardness of the breast tissue. Usually, it's accompanied with premenstrual breast tenderness. In phase 2, there's going to be increased hardening and tenderness, cyst formation, moderate modularity. And finally, as it continues to progress, we will note that tenderness and microcyst formation is going to occur as well. What is the etiology? In other words, what's the origin of this disease? Now, in many cases, we're looking at hormonal bases, corpus luteum deficiency, anovulation. In other words, women that do not ovulate, premenstrual tension, PMS, more likely to develop fibrocystic breast disease. Estrogen versus progesterone, those two, we will be discussing that in detail. And other speakers also connect estrogen dominance and progesterone deficiency to fibrocystic breast. That's usually considered causative. In other words, estrogen dominance, as is well known. Women with progesterone deficiency actually carry a 5 times risk of developing breast cancer. Also, prolactin levels are increased in 1/3 of women with fibrocystic breast disease. That's usually accompanied with some form of nipple discharge. Hypothyroid, suboptimal levels expose mammary epithelium to prolactin stimulation. Finally, things like increased intake of coffee, tea, alcohol, soda drinks, even chocolate is associated with development of fibrocystic breast. Now, inadequate essential fatty acids, primarily we're talking about low levels of gamma linoleic acid, GLA. These acids are usually coming from or kind of get to us through nuts and seeds. Now, fibrocystic breast pathology. Generally, it starts with cysts. They could be simple, or at some point they become complex. Then we're looking at fibrosis. Fat and elastic tissue is going to be replaced by fibrous tissue. Then we're looking at hyperplasia, where ductal lumen, in other words, the inside of your duct in the breast, will get full of cells. And this already could be a premalignant condition. And finally, we're looking at papillomatosis, where papillomatous growth within the ducts. Papillomas, everybody kind of have heard of HPV, human papilloma virus, but this is slightly different, where wart-like growths are occurring within the duct. And eventually that can also lead to cancer as well. So you can see that there is a progression specifically from one side all the way to the other. On physical examination, nodular lesions with lumps. In other words, palpation is usually done best between the thumb and the finger. There are going to be movable lumps, not adherent. No axillary nodes enlarged, no retraction of the nipple. And testing for fibrocystic breast disease, generally, I would suggest that ultrasound is the most appropriate test. Mammography is not specific for fibrocystic or dense breast. And also thermography accompanied with the ultrasound happens to give additional information in terms of overall risk assessment and follow-up. The ultrasound, like all tests out there, they certainly has advantages and disadvantages. The advantages are that there is no radiation, more specific to dense and fibrocystic breast. The ultrasound will differentiate between fluid-filled sacs or cysts and dense mass, and can image non-palpable masses. It is also safe for pregnant or women with breast implants. The disadvantages, however, is that ultrasounds usually don't go very deep inside the breast. In some cases, they may not distinguish between abnormal from surrounding tissue. It also is operator dependent. That's training and experience may vary depending on who is performing the test. And finally, It does not kind of distinguish between normal tissue and tissue with microcalcifications, which is also considered to be by many as a precancerous state. So the breast thermography, on the other hand, and I'm just not going to compare this to any other tests like mammography or ultrasound because it's just not fair. Each and every test provides its own information, and it has limitations and it has advantages. The advantages of breast thermography is that it measures heat from the surface of the skin with infrared radiation that comes out of the surface of your skin, or through the surface of your skin, I should say. It is an early detector. It certainly is used as risk assessment. It's non-invasive. There's no contact. There's definitely no radiation. For a change, you're actually radiating the camera. It's suitable to all types, shapes, and conditions. In other words, there are many women with large or small breasts, different types of shapes, as well as women with dense breasts, as well as women with breast implants. It has been approved by FDA since 1982 as an adjunct to breast cancer screening. There's been numerous, actually over 800 peer-reviewed studies on breast thermography. The disadvantages of breast thermography is that it is not a structural test. It's more of a functional test. In other words, it tells us how your breast functions versus looking at structural changes like ultrasound, MRI, or mammography. And again, it could be used as an advantage as well as disadvantage, is that thermography being a functional test, function will always precede structural change. In other words, things will start changing on a cellular level before they're going to be changing anatomically or structurally. Here is something that I want to explain to someone who is not familiar with thermography. Certainly could be used as treatment monitoring. On the side here, if we see a color scale where darker colors are cooler temperatures, whereas lighter colors are warmer temperatures. So in this particular case, we're looking at a thermal window between 36 and 26 degrees Celsius. And as you can see here, with this particular example, most of these developments in both breasts are in the vicinity of 34, 35, sometimes even 36 degrees Celsius. However, 6 months later, we're looking at this picture where someone who goes from moderate risk to a fairly low risk in terms of developing breast disease. And this is also just after 6 months of indole-3-carbinol supplementation. Indole-3-carbinol is made from cruciferous vegetables. A lot of you may know, some of you may not know. So I'll just say that cruciferous vegetables are definitely implicated in appropriate or estrogen metabolism. Helps to metabolite estrogens more effectively. So you can see how thermography could be used, and this is a comparison before and after, just after 3 months, and with using indole-3-carbinol as a supplement. Treatment when it comes to fibrocystic breasts usually ends up with needle aspiration. Naturally, of course, it's not the most comfortable procedure. It's fairly invasive. It's fairly traumatic. And in the experience of many women, these fluid sacs or cysts usually come back, and usually they come back with vengeance, because it's not really addressing the etiology, or it's not really addressing the reason why we have these cysts and nodules in the first place. It's just addressing the symptom. So, as I alluded to, address the cause and not the symptom. In other words, hormone imbalance is #1 contributing factor. Then we're looking at also prolactin levels, which you can definitely check with a simple blood test. Then we're looking at thyroid dysfunction, inadequate essential fatty acids, methyl xanthines, environmental, dietary, and metabolic toxins. Now, I want to emphasize one particular issue here is that we're dealing with primarily in the past 40 or 50 years with iodine deficiency. And when it comes to iodine, we have to know that breast is one of the main storage sites of iodine in the body. Normal breast architecture will not even develop when there is iodine deficiency. Iodine deficiency can also alter structure and function of the breast. And finally, in an iodine deficient state, the breast and thyroid will compete for iodine. One thing to also note is that diseased breasts will uptake more iodine than healthy breast. Now, modern day diet is iodine deficient. In other words, we do not eat enough ocean fish or sea vegetables. Inadequate use of iodized salt, and we'll come back to that issue. Many women are on vegan and vegetarian diets, which are also deficient in iodine. And then there is another kind of issue, which is bromine in food and drink. Drinks, well-known drinks like Gatorade or Mountain Dew or other soft drinks, bakery products also contain bromine it's also added to bread, pasta, cereal, et cetera, So it's quite prevalent out there. We will come back to the bromine specifically. So why is this happening? Well, as I mentioned, over the last 40 years, iodine levels have declined by more than 50%. At the same time, breast cancer rates have risen dramatically. And not just breast cancer rates, but thyroid illness, autoimmune disease, and generally cancers have risen dramatically as well. The use of thyroid hormones, in other words, thyroid medications, in the presence of iodine deficiency will actually exacerbate an iodine deficient condition. So I'd like to present a few studies. Iodine is effective in treatment of fibrocystic breast. This particular study used 167 patients. They were given 10 to 20 milligrams of iodine a day. And after 3 months, there was a 72% improvement in swelling, in nodularity, in pain, and diffuse induration of the breast. There were no side effects reported. This was published in the good old USSR in 1966. Another study shows the effectiveness of iodine treatment in fibrocystic breast. And keep one thing in mind, that iodine is actually the most researched element in treating breast disease over the past 100 years. So in this particular study, 233 patients were used. They used Lugol solution, which is my personal favorite, 5 to 10 drops, which is a fairly big dose. That's between 31 to 62 milligrams a day. Now, out of this group, 3% developed iodism, in other words, adverse effects. And these would include thirst, diarrhea, weakness, palpitations, etc. However, 70% of these women had clinical improvements. This was also actually published by the Canadian Journal of Surgery in 1993. So iodine deficiency results in oversensitivity to E2. In other words, there is a connection between iodine and estrogen. Now, just to review, there are 3 major forms of estrogens. There is estrone, E1, is the primary form of estrogen that your body makes after menopause. There is Estradiol, E2, is the primary form of estrogen in your body during reproductive years. It's the most potent form of estrogen, and it happens to be cancer prolific. And finally, there is estriol, E3 is the primary form of estrogen during pregnancy. Now, remember when I mentioned that women that have multiple pregnancies seem to be protected for fibrocystic breast and seem to have less incidence of breast cancer overall. And this is the most protective estrogen of them all, the E3. However, the iodine deficiency, as I mentioned before, results in oversensitivity of estradiol, which is E2. Iodine has also been shown to decrease inhibition of BRCA1 gene. It's a gene responsible for human suppression. For tumor suppression, not human suppression. Iodine and breast cancer. Now, we know that in Japan and Iceland, there is definitely a higher intake of iodine and lower incidence of breast cancer. In the United States, Canada, there's the reverse of that. There's lower incidence of iodine and higher incidence of breast cancer. So if we look at breast cancer mortality rates per 100,000 population, in Canada, we have 22.4. In the United States, we have 22. In the United Kingdom, we have 27.7. And finally, in Japan, we have 6.6. And the reason for that is that Japanese ingest 100 times the recommended daily allowance for iodine, close between 12 to 14 milligrams a day. Now, RDA is definitely not sufficient for iodine in the environment that we live in. So much lower rates of fibrocystic breast also happen to be in Japanese population, but not only in terms of breast, also endometrial and ovarian cancers. I'd like to also emphasize that in the Great Lakes Basin, in other words, in the Goiter Belt, this is where I'm located, and this is where we, quite a large percentage of the population happens to live, has the lowest iodine levels and the highest levels of breast cancer rates in North America. So iodine as a therapeutic agent, number one, it's an antioxidant. It also has alkalizing properties. It also has detoxifying properties. Iodine happens to be an antibacterial, it's antiviral, it's antiparasitic, it's antifungal. So in this particular case, anti happens to be good rather than bad. Now, it also triggers cells into apoptosis, which is a process where cells are programmed to eventually die off, where the new cells can start additional growth. Whereas with malignancies, unfortunately, these cells do not die, they just continue to replicate. So iodine also changes tissues for hyperplastic to normal, not only in fibrocystic breast, but also happens to be in thyroid as well. And finally, iodine as a therapeutic agent has been used in mucolytics, such as anti-mucus. Anyone who's had edemas or when they are suffering from lung infections where they are retaining water in the lungs, iodine is frequently used in emergency medicine as well. Iodine as a detoxifying agent, it detoxifies the other halides, such as bromine. We've mentioned bromine before, but also I'd like to introduce fluoride and chlorine. Fluoride is well known it's used in your toothpastes and as well as many other kind of places. And of course, chlorine, we still have chlorine in our water supply. I will come back to bromine. I'm not going to be talking about fluoride and chlorine because we just don't have enough time for covering those two in detail. But I also want to emphasize that iodine happens to detoxify toxic metals. And very few people know that it actually has an effect, a detoxifying effect on mercury, lead, aluminum, as well as cadmium. So back to bromine. Bromide causes iodine deficiency. So bromide is a competitor. It inhibits iodine. In other words, it goes to cell receptor sites for iodine and just blocks them. So it is fairly insidious. It's used in many common products, as well as in pesticides. And because of the sheer number of bromide supplemented foods, exposure to this man-made additive has caused a depletion of iodine in human populations. So studies in lab animals provide alarming evidence that even small amounts of bromide exposure can be toxic. So products containing bromide found in pesticides, bread products, vegetable oils, citrus flavored drinks, hot tub cleaners, certain asthma inhalers, certain prescription drugs, plastic products, and some even personal care products, as well as fabric dyes and many, many more. So if anyone's interested in looking at additional information for effects of bromide on the organs, please go to this particular website, breastcancerchoices.org, bromide dominance theory. So it's breastcancerchoices.org. Iodine happens to be the gatekeeper of breast integrity. In other words, during lactation, the breast is more effective in capturing iodine than the thyroid. Iodine treatment of benign breast disease is accompanied by reduced breast size and remission of breast symptoms. And finally, iodine induces apoptosis, as I mentioned prior to this, by formation of iodolactones and of arachidonic acid in both thyroid and breast disease. Iodine-rich foods, just to give you a few, you can see, for instance, here, seaweed is probably one of the most effective ones, but also natural kind of ocean-going fish like cod, even baked potato has some iodine, and so on and so forth. Now, as I said, the numbers here simply represent percentage of RDA, which is definitely not sufficient in this day and age. How much iodine? Definitely, we're not talking about iodized salt. Common table salt does contain iodine in very, very small amounts, but maybe just enough to kind of keep people alive, but definitely it has other disadvantages like whitening agents and all sorts of impurities. It doesn't really have the micronutrients that you are getting from real sea salt, like Celtic salt or Himalayan salt, for instance. Using a combination of iodine and iodide or iodide, which is basically kind of something like Lugol solution, is more effective than iodine alone. Now, I decided to provide you with some labs and articles that you should read before testing, because testing may be controversial. So the first two labs, one is Hakala Labs and Optimox, are very common in terms of iodine loading. You can go to these sites. However, I decided to add an article from ZRT Lab, which discusses the flaws of iodine loading urine test. I think you should be aware of that as well. And finally, there's another kind of link here to natural EndocrinSolutions.com, this particular article compares 4 methods of iodine testing. Please do your own research, and see what kind of feels best for you. Now, my recommendation is no matter what you do, start slow. There's no reason to start kind of dosing with huge doses of iodine. That's definitely not a good idea. But also, I do suggest that you test pre and post levels. You can do the iodine loading test. There are many other ways to test. I also suggest that you get the ultrasound as well as thermography before starting the treatment. But don't just do one thing. I think the most effective way would be to combine that with an appropriate diet, certain vitamins, minerals, which I'll discuss in a minute, good salt, and finally, detox. Here's something that I wanted to show, what I call a blind spot. This is the same woman that from 2007 to 2010 has developed, as you can see in her left breast, quite a significant development, most likely malignant. The nipple temperatures here are borderline, where here they are definitely way over normal, not just nipple, but perioral temperatures as well. What happened here is that this woman only used progesterone cream. Now, why I call it the blind spot is that in many cases, women rely strictly on blood tests or saliva tests to check their hormones. And invariably, these are good tests. However, in about 10 to 15% of women that we see, there is some form of an anomaly where that progesterone, for different reasons, happens to kind of go from progesterone to estrogen. There are different kind of functions, and progesterone can turn into estrogen. If with coffee, with alcohol. So again, without kind of going into details, I just want everyone to understand that just relying on blood tests may not be sufficient. And this is where thermography can be very, very useful, because in some cases, we just don't get enough information just by using blood tests or saliva tests or even urine tests. So where progesterone metabolizes into estrogen as well. In thermology or thermography, we're using the TH rating, which is a scoring system. It's an international system of TH rating stands for thermal. TH1 is the lowest risk. And as you can see here, basically it's more or less symmetrical formation with a fairly low score, and therefore it's low risk. Then as we start developing a little bit more asymmetry, it's still low risk, but this is now a TH2. Then we get into fairly asymmetrical left breast here, which is TH3, TH4, and finally TH5, which is the highest risk. Quite obvious, this is a very kind of nasty situation. So my prevention recommendation is, number one, I advise all women to do a monthly breast examination. It's not difficult to do. And there's a lot of information that if you don't know how, you can just go online, and it's fairly simple to do it on a monthly basis. Now, clinical breast exam with a 6 months follow-up for those who have already atypical hyperplasia or history of breast cancer in the family, or history of ovarian or prostate cancer in the family. I also advise women to, when they do their ultrasound, is to make sure that it's going to be within the same point within their cycle. In other words, let's say if you're doing your ultrasound between days 7 and 10 of your cycle, then next time try and come back within the same day 7 to 10 of your cycle, because as I mentioned before, things will expand and contract. So if you're comparing, let's say, breast at day 7 to breast at day 27, now you're going to be comparing apples and oranges and not really getting kind of accurate results. Annual thermography is also recommended if someone is low risk, someone who obviously is at higher risk, perhaps is going to be looking at more frequent thermal imaging. Avoid caffeine. Caffeine basically converts not only progesterone to estrogen, but also testosterone to estrogen. I want to mention that 2 cups of coffee a day will rob you of 60% of your testosterone, and that testosterone is not going to disappear. It's going to be converted to E2, estradiol. Tea also has caffeine, chocolate, soft drinks, trans fats, and finally, alcohol will have the same aromatizing effect. Aromatizing, basically converting good, it's what to say good because, but let's say aromatizing effects will convert testosterone and progesterone to estradiol. Treatment, correct the hormonal imbalance. As I said, it's probably #1 cause of fibrocystic breast. Natural progesterone is definitely, and when I talk about natural progesterone, I'm talking about bioidentical, not synthetic. I always suggest an anti-estrogenic diet, low animal fat, low dairy, low glycemic foods, indole-3-carbinol or DIM. Both of these substances are made from cruciferous vegetables, and they are very, very helpful with estrogen metabolism, regulating estrogen metabolism. And finally, a detox. I would also suggest that thyroid dysfunction could also be addressed with iodine, but iodine is not the only thing. You definitely need other things as well, but in some cases, it's very, very helpful. Now, as far as vitamins, you should be looking at vitamin A with 20,000 international units. Vitamin B6 is very helpful. C, 500 milligrams plus, depending on your bowel tolerance. I don't think that it's necessary to go to huge doses with vitamin C, but definitely it's something that could be very useful. Vitamin E is also useful. Vitamin D3 plus K2, it's important to have the K2 there as well. Magnesium is a wonderful mineral, also fairly deficient. And I think at this dose, it's very, very safe. Some people will need more magnesium, depending whether or not, again, they're drinking coffee or smoking cigarettes, which is leaching magnesium. Selenium has been kind of soil deprived for a long time. In our soils, it just almost kind of disappeared. So selenium supplementation is also very helpful. And finally, zinc. I mean, we've heard last couple of years a lot about zinc, and I think anywhere between 15 to 30 milligrams could be very helpful. These minerals are also synergistic, not just to the above mentioned vitamins, but also to iodine supplementation as well. As far as botanicals, although not all of this is botanical, but Agnus castus, which goes by kind of other name like Vitex, also helps regulate estrogens. Oil of primrose, and finally, women that have kind of extreme pains or swelling of the breast, usually premenstrually, can be using things like castor oil packs. They could be very, very kind of soothing. Finally, I want to kind of add that there is hope, and not just hope, there's definitely evidence. And in summary, I'm suggesting that we do use testing, and we do look at prevention, of course, and finally, as I mentioned before, there are several treatment options that not only prevents but also treats fibrocystic breast. If anyone wants additional information on fibrocystic breast disease, please see my article at thermographyclinic.com, fibrocystic breast disease. It's a little bit more specific in terms of using homeopathics and other botanicals. You can also, you're certainly welcome to look and get my book that I published a few years ago called Breast Cancer is a Preventable Disease. And last but not least, I want to thank you for spending the time and becoming kind of more proactive when it comes to your health. I'm sure that you will be listening to other presenters today, and they all are of excellent quality. They're world-renowned experts in their field. So I want to thank you. I want to say grazie. I want to say dziękuję, danke, merci, spasibo. If I've missed out a few other languages, please forgive me, but I think you get the drift that I'm very grateful for you taking the time to learn about fibrocystic breast disease with me.